You know, being number one is always a great thing, but not in the case of obesity and diabetes, and Mississippi is number one in both. Well, today we're talking to Dr. Foss at a very special place. They call it NDORI, but that's kind of short for something very special, right?
Right.
Tell us about that.
Sure. NDORI is a National Diabetes and Obesity Research Institute, and our mission is to try to reduce obesity and diabetes in Mississippi, because we are the worst, and also help spread the information to the rest of the country. Plus, diabetes and obesity isn't equally distributed in the population. African Americans are higher rates of it than whites and Asians and Hispanics. So we're going to look at those disparities to see if we can change that. Mm-hmm. And also we're going to conduct and share information from our clinical research and other activities we do here to help to hopefully come to a cure for diabetes.
And cut down on obesity as well.
Cut down on obesity.
Well, the clinic here is absolutely awesome, and we're going to tell you some more things about it right now. Now, Emily is project coordinator, and Lisa is director of education here at NDORI. So first off, if you would, Emily, tell us about where you're located. It's pretty easy to find.
Yeah, we're at North Biloxi, off Highway 67 on the Tradition Learning Medical City. Mm-hmm. We're nestled right between William Carey's Tradition campus and Mississippi Gulf Coast Community College, the Bryant Center. Mm-hmm. So right here, Memorial Clinic is also in the front, and we're in the back part of the building. We have administrative offices, and then we have our clinic, lab, and our training room.
Talk about the community involvement of NDORI.
Yeah, so we often try to get out in the community outreach, mainly educating the population on diabetes and obesity, and then bringing awareness to what we're trying to do here.
Well, as I mentioned before, Mississippi unfortunately is number one in both areas, in obesity and type 2 diabetes. And I hate to say it, but we like to eat. You know, that's one of the things down south. It's good food down south there. We do like to eat. But you actually, when people start coming in here, you schedule them, you talk to them, get their backgrounds and everything?
Yeah, so we have a number of different opportunities for patients as they come in. They can see a provider, they can see our dietitian, they can get the education they need, the treatment, and then eventually once we have research projects underway, we can funnel them into those various projects as well. So
and they don't need a referral from their primary physician?
No, they do not.
Okay.
So they can just contact us and we can see the best pathway for them here at NDORI.
All right, and Lisa, talk about what you do as the director of education.
Right now, we're developing the services for the weight management, and so it'll be a medical weight management clinic and diabetes education. One of the unique services we're offering are called shared medical appointments, and this is a multidisciplinary group appointment. So you'll have 5 to 10 patients in a group setting with multiple providers to get their education and their medical appointment simultaneously. So it provides a lot of benefits to the patient for outcomes. They get the support and the camaraderie of others that have the same diagnosis.
Right.
So we're being trained by our Cleveland Clinic affiliates, and we'll be launching this down here.
All right.
At NDORI.
Well, we want to step into the classroom and show some of the great tools that they use to help people who are battling obesity and diabetes. Well, we're in the training room. Lisa and I have come in here, and we've been joined by Debbie, who is another one of the educators. Lisa, tell us about this special event y'all have coming up in January.
We're starting a medically supervised fasting program. It will run for 26 weeks. The exciting part to me is this is a program that's been in existence for over 35 years. Mm-hmm. It has a tremendous amount of evidence-based medicine or research behind it that shows positive outcomes for patients with diabetes to help reduce their risk, those that are pre-diabetes, or to help those that, are diabetics with excessive medications to even limit some of the medications they're taking in. So they're able to, oftentimes with weight loss, omit some of those medications.
I was going to say, do you find a lot of obesity and diabetic patients, they want to just depend on the medications instead of trying to change their lifestyle?
Absolutely.
It's an easy way out, it seems to be.
And Debbie will be able to speak to some of that as well. But this is a program that we don't have in South Mississippi. And I worked with the program years ago and saw the outcomes and the weight loss patients had, and the success that they had. And what it does is it's a fasting program, and fasting is very popular right now. but people do it without the medical supervision. So we're bringing it to South Mississippi medically supervised, and also having the behavior modification component, so people can learn what has got them in the state of excessive weight to start with.
Mm-hmm.
We're eliminating cues to food, so they get to start all over. Cleaning the hard drive.
Flushing it all out.
Flushing it all out,
Because I
yeah.
see, you've got, plates set up here and, things on planning your portions out. Really, as you said, you've got to change your way of eating. And as I mentioned before, we like to eat down here. Not necessarily really good at times, but we do like to eat.
And so in this program, people are going to learn the behaviors. I think that's what the behavior modification to me is one of the most important parts to weight management.
Yeah. Now, if you would, Debbie, tell us about, as far as what you do as far as educating people.
Well, NDORI is one of 2 accredited diabetes education programs on the Mississippi Gulf Coast. And we provide extensive diabetes education, discussing when the patients come in. We use a curriculum called Journey for Control Diabetes Conversation Maps. And this is a picture of a smaller map right here, but the map is about 3 by 4 feet, sits on the table. It's highly interactive. So the patients not only learn from the educator teaching the class, but they learn from one another in the group setting. They tend to come back for 3 different visits, and they establish their own support system within the group. And support is critical when you're trying to change your lifestyle. You need to recognize you're not in this alone, and you have others there that help you. In the classes, we discuss healthy eating, and these are some of the resources we use. We talk a lot about the plate method. And with the plate method, 1/4 of your plate is your protein, 1/4 of your plate would be your grains, your breads, your cereals, and 1/2 of that plate we really want to fill up with our fruits and our vegetables, because those are healthy. They tend to be lower in carbohydrate, our vegetables do, and they can help fill you up. We also talk about physical activity, which is extremely important.
Definitely.
How to get started with an exercise program, how to identify the types of exercise that might be best for you. We talk about monitoring your blood sugar, how to use their monitors, when they should be testing their glucose level. Talk about the medications that they may be on and how those medications work, as well as healthy coping, because managing diabetes is not easy. And so we teach stress management, some coping strategies, as well as talk about other risk factors that may be present: smoking, blood pressure control, cholesterol.
Right.
All of those things can play a role.
I hate to cut you off, but we're about out of time. But if you'd like some more information, the number's on your screen. The information is all there. You can call them and find out more information about NDORI.